is there, but I don't.
With Judith, we're a small care home in Jersey, private care home. Judith wrote a letter to the JEP, which was quite outspoken. What was the main theme of your letter, Judith?
The main theme of my letter was regulations in Jersey and regulations for home care in particular.
And you've worked in home care elsewhere, outside of Jersey?
Not in England, no. Not in home care. Care homes, yes.
Care homes.
Yeah.
You might have to explain the subtle difference between home care and care homes.
Care home is obviously a residential home or a nursing home. Somebody comes to live in the home. Home care is where we provide the staff to go into somebody's own home and look after them at home.
Right.
Care in the community.
The staff for this, the residential part of this business where we are today, is that what category is that? What category of home is that?
It's residential.
It's a residential. And that's regulated under Jersey law, that's inspected, that side of the business is regulated?
It is,
under
yes.
Jersey regulations?
Under Jersey, yeah.
Is that much different from UK regulations?
The inspection isn't. The standards are different. They're about 10 years behind the UK standards.
So from your perspective, you think there's scope for improvement?
Yes, lots of scope.
Staffing for the residential part, is that difficult?
Not really. It's just a case of finding the right people, making sure that they've got the right training, right attitude. Doesn't necessarily mean that because somebody's got lots of qualifications that they're the right person for the right job. And we've been pretty lucky here.
What number of beds have you got here, or number of rooms?
20.
So it's a small unit. Is that a viable unit? Obviously you're in business now. Is it long term? Because we hear a lot of residential homes getting in financial difficulty, even very large ones getting in financial difficulties.
Well, obviously it's viable. Otherwise we wouldn't be here. I mean, we wouldn't have set out the business if it wasn't viable. Can't really comment on the bigger.
We hear some horror stories from the UK. There's yet another report out this week about a care home where they're having abuse and so on. Do you have any knowledge of that in the UK? Have you ever experienced any of that?
I've not experienced it in any of my homes. I have heard of cases the same as everybody else has, but not in my homes, no. And
your staff here, everybody, gardener, cook, they all have to be checked, security checked?
All police checked, references taken up, right from myself right to gardener, domestic.
But that doesn't apply throughout the industry in Jersey? That's not all residential homes have to do that?
It's a requirement for private homes. It's not a requirement for homes that are owned by the state, so I believe. But I couldn't be 100% sure on that.
I wonder why that is. I wonder why they don't want to regulate the same standard in the state system. It's rather curious, isn't it? Which part of the world are you from, actually?
Originally from northeast England.
Right. I understand that people living in their own, because this is part of this inquiry, the reason we're interviewing you today is part of the white paper that's currently out about people caring for themselves in the home. And people in the UK receive a sum of money from the government to employ their own carers, and they can choose on a contract basis.
Yeah.
Now, obviously, the service you're operating here could work under that scheme, couldn't it? For people living in their own homes, you provide care workers to go and care for them.
Yeah, we're doing work exactly the same.
Again, security, you say, it's the same standards apply. You have to have inspected staff.
For home care, you don't, no.
You don't, but you would have to.
But you would have to in the future.
And in the UK, you do now.
You do in the UK, yeah.
If you employ people on that basis, who employs stamps their card, that sort of thing? Are you the employer for the carers, or is the person who's receiving the home care, they're the employer?
In that case, it's the person for the direct payment scheme. For that case, it's the person that is paying for the care.
Right.
If you were paying for care from an agency, then it would be up to the agency to make sure that the staff were able to be employed, but it would be up to the person that is paying the money to make sure that the checks have been done.
The white paper, as it now is, has been floating around as a green paper before. A couple of years ago, as white paper now on care in the community. Huge changes are anticipated in care in the community. People to care for themselves as far as possible in their own homes. How does that grab you? Does that sound like a realistic scheme for Jersey?
I think it's realistic. I think it's achievable as long as they make sure that the right resources are in place and the right staff are there to look after. That would be my worry, that are we going to have enough, is Jersey going to have enough staff to be able to look after every single person that wants to stay in their own home?
There is training locally, but quite a lot of staff would have to be trained outside and brought in, presumably.
I would imagine so, yeah.
The sort of specialist care that people can need, can you provide that in the residential part that you've got here? Can you provide specialist care? What degree of care can you give with extreme disabilities? Can you cope with that?
We mainly give personal care. We're here to provide personal care. We can look after people with special, sort of more complex needs, but it really depends on what the needs are, and that all, we do assessments before they come in, you know, so if there's somebody that we're not able to cater for that need, then we would have to say we couldn't look after them at here.
Again, in the white paper, as it's now evolving, the care in the community will be a very comprehensive system with GPs, social workers, mental health care workers, all involved, and it sounds wonderful, this sort of scheme. Everybody's cooperating and talking to everybody, and they're sharing IT information. If it ever gets together, it'll be amazing. But have you ever known a system like that working anywhere? Do you know where they got that sort of care?
I believe I believe somebody said that Sweden have a very good system like this. The UK, in theory, have a good system. You deal with one person, and that person collates the information. Like everything else, that's in theory. If they don't have the resources, it's not always possible to carry it out.
They were talking about schemes whereby doctors, it won't be unusual for doctors to visit their patients in their own homes. Your residents who are living here, do their own doctors visit, or do you have your own doctor who visits anybody who's here?
No, their own doctors.
Their own doctors. Can you imagine a scheme whereby social workers, mental health workers, all these sort of people would visit here and they'd be drawn into a sort of a general care system? Would that work from a residential home point of view?
Well, they do already.
Yeah.
You know, we do work sort of closely with the agencies. You know, we get social workers coming in here. We refer to occupational therapists if necessary, or physiotherapists if necessary. So we do get multidisciplinary teams coming in.
Because part of the thinking is that people will go into hospital care for as little time as possible. Now again, if somebody from here, one of your residents, went into hospital for some treatment in hospital, can you easily accept them back here again and carry on with what nursing they might require?
We can, depending on what needs it is. Yeah.
But generally
we do.
There are some very large residential care homes in the island, parts of UK groups, some of which have got huge financial debts or have had. Do you have any thoughts on those? Do you know anything about how they operate? Or what,
well, I actually used to work for Southern Cross, which was one of the biggest ones, and unfortunately went bust. I saw them, I worked for them for 5 years, and they kept just buying up property. You know, that was the main. They would buy a property, then they would lease it out. Councils cut the finances, the money that they had to look after people. and so the deficit grew bigger. You know, what started out as profit making gradually just got into deficit because you couldn't. There was less people in England that would pay privately, so your fees are a lot less over there than what they are here.
What sort of comparison is it? What's a UK resident weekly?
A UK resident in a residential home, you're looking at around about, in the area that I worked in, was around about £370 a week.
Compared with Jersey?
Compared with Jersey, 805.
Right. So where does that difference, who makes it up? Somebody, you have to be exceptionally rich, or does the Jersey states make up that difference in Jersey? Who pays for that?
Well, the 805 is the Jersey, that is the Jersey level that we get for somebody in residential care. The 300 was somebody if you were in England, that is the level in England.
Really?
But then again, in England you're not paying the higher wages, what we do in Jersey.
There are a lot of people in Jersey who haven't been here for all their lives. They've got degrees of residence. Does that cause a problem? Do people come to you who haven't got the status to get paid for by the states?
Yeah, we've had a few inquiries, and that is they have to, if they've not been in Jersey for sort of 10 years, I think it is, they have to pay for themselves.
And that obviously could be difficult for some people.
Yeah.
If they haven't got the money, what happens to them?
I don't know. I mean, we've had inquiries from people that maybe, you know, sons and daughters live over here, but mum and dad are back in England, but they want to bring them over because mum and dad are getting old, and they have to have the money to fund themselves.
Even large organised home care and nursing, I think they call themselves, they've had their states grant. They're 70% funded by the states in Jersey, but they've had that considerably reduced over the last 2 years under the cuts, the savings scheme, which is in operation at the moment. It's a diminishing finance that's actually happening, but the scheme, the white paper scheme, requires an extra finance, considerable extra finance, I would think. Is the money there? I mean, you're at the sharp end, you've got to make a business, you've got to get people to pay to come here. Is there money there to be had?
I think there's money there, just don't think it's always forthcoming.
Well, the Swedish example you quote, the Scandinavian people pay very high rates of tax, and apparently, so we're told, they're happy to pay their very high rates of tax because they get proper medical services, health services and care, they get those services. Whether they do pay quite so willingly, I have no idea.
Well, they don't get an option, do they?
I wonder if they don't. Your team that goes out caring for people in their own homes, how big could you make that? Because we're told the number of people who are going to require that service is going to be very big, very large number of people we're told are going to need that service. What limits you? Is it only recruitment, or are there other factors?
At the moment it is recruitment. It's recruitment and getting good staff. You know, I'm not prepared to take on just anybody, you know. I know income support at the moment are very keen. We've got some people that only want to work a few hours, you know, because of childcare and things like that, and they're under a lot of pressure from income support. We had somebody that used to come here as a volunteer. He had to finish because income support, it was either a full-time job or nothing at all. You know.
Well,
so unfortunately it was nothing because I didn't have hours to give him. He was keen, wanted to learn, but I didn't have hours. But I had to let him go because I didn't have a full-time position to offer him. And I think this is where I am finding it difficult to recruit into some positions because a lot of the positions we have here are just part-time, and people have been told by income support, no, you need to get a full-time job. So that's a difficult bit I find at the moment.
Yes, that's rather a strange view, isn't it? You'd think they'd be prefer to have somebody working in something useful than
Yeah.
not working. Okay, unless you've got any more thoughts, we'll leave it there.
Okay.
Thanks for your time.